In Sheffield, we have a weekly improvement meeting with community health and social care staff. In one of those weekly meetings, one of the attendees asked, when our patients, the frail older ones, have completed their acute phase of care, why do we assess their ongoing support needs in hospital kitchens, hospital bathrooms, hospital staircases, when actually those back in the patient's own home are nothing like the ones we have in the hospital environment? That led to discussion. One of our therapists volunteered, said, I'd like to be the first one to try to flip this over. Instead of assessing the patient to plan their discharge support needs, could we actually discharge a patient to their own home and assess them as they got home and meet their care needs in real time? During that week, a patient and their family were found and gave permission for this new way of working to be tested. The next week, the therapist reported out what happened. She said, I didn't think this was going to work. As I got to the patient's home, the frail older lady who we were working with actually grabbed hold of her own furniture and came alive. The assessment finished with her making me a cup of tea. So we carried on more tests, more plan, do, study, act cycles, developing a whole new way of working. We're now able in Sheffield to discharge a frail older person, and our fabulous active recovery service in the city then meets their equipment, home care and ongoing rehabilitation needs in real time starting that day. We've seen a dramatic saving in hospital bed days. Last year, over 10,000 patients got home 4 days quicker than 3 years ago. That's 30 to 40,000 acute bed days taken out of the hospital environment and patients supported in their own homes at a much lower cost. That's 4 extra days at home, getting back to independent living with the patient's family. And we know very well that actually that's what our patients want.